Do you wake in the middle of the night with your calf suddenly locked in painful spasm? Have you been told to take magnesium and heard that it helped many people but does nothing for others? So, what's actually true? Night cramps are extremely common after 50. My wife and I both have had them before. For me, they tend to happen when I haven't slept enough or haven't done my regular stretching, haven't done my regular exercise, and my muscles feel tight and unreleased. These cramps are intensely painful, completely spontaneous, and deeply unpredictable. They wake you up from sleep and make you wonder whether there's something wrong. What's going on? Let's go through this clearly. A nocturnal leg cramp is a sudden, involuntary, strong, intense contraction of a muscle, usually the calf, lasting seconds or minutes, but it often leaves soreness the next day. They become more common with age, not because we suddenly become mineral deficient, but because our nerves and muscles change. Motor nerves becomes more excitable. The system becomes more irritable. Here is the first reassurance. Most night cramps after 60 are not dangerous. They are very painful, however, and very disruptive, but they are rarely a sign of something life-threatening. Now, the key question. Is this magnesium deficiency? Just because taking magnesium helps some people, it does not mean magnesium is deficient. I will come back to that later. When magnesium is truly low, hypomagnesemia, it can cause muscle irritability, tremor, fatigue, and sometimes heart rhythm disturbances. In hospitals, we treat real deficiency with oral magnesium, commonly magnesium aspartate in Australia, or intravenously, if it's severe, with magnesium sulfate. That is deficiency medicine. But most people with night cramps have normal magnesium blood levels. They are not in biochemical deficiency. So when people take magnesium for night cramps, they are usually not correcting the laboratory abnormality that's shown in the blood. Even when magnesium seems to help, it does not mean that there is a deficiency. They're trying to see whether adjusting neuromuscular excitability might reduce symptoms. That is a different goal. If most people aren't deficient, why do so many doctors still suggest magnesium? Because magnesium plays a role in muscle contraction and nerve stability. Even when blood levels are normal, it is biologically plausible that increasing magnesium intake might slightly shift muscle excitability in some individuals. And because the risk is low in people with normal kidney function, a short, time-limited use is often considered reasonable. That is very different from saying that it is a cure. We also need to be honest about the evidence. Most clinical trials that studied magnesium for night cramps use forms like magnesium oxide or magnesium citrate, not magnesium glycinate. The most heavily recommended and marketed form of magnesium today is magnesium glycinate. Magnesium glycinate has not been specifically well studied in leg cramps for age-related nocturnal leg cramps in large-scale studies. So we are in a gray zone. We cannot say magnesium glycinate is proven to work, but we also cannot say it has been properly tested and failed. Magnesium glycinate is popular because it is usually better tolerated than oxide, less likely to cause diarrhea, and many people perceive it as calming. Some report improved sleep Better sleep alone can reduce how disruptive cramps feel. From my own experience, when I'm sleep deprived and tense, that's when cramps become more likely. So anything that improves relaxation and reduces muscle tension may indirectly help. That may partly explain why some people swear by magnesium glycinate, and while others notice no difference at all. Some people who did not respond to other forms report improvement after switching to glycinate. So if you're asking, should I try magnesium glycinate? Here is the balanced answer. If you're having recurrent night cramps, it is worth letting your doctor know so that more serious causes can be considered and excluded. You can then discuss how to best manage disruptive symptoms in your situation. If your kidney function is normal and you're not on medications that interact with magnesium, trying it for a few weeks is quite reasonable. Around 200 to 400 milligrams of elemental magnesium in the evening. The word elemental matters. It refers to the actual magnesium content, not the total compound weight. If it clearly reduces frequency or severity of cramps, continue. If it does not, stop. It is not the cure. It is simply seeing whether it helps you in your case. Now, let's talk about what helps more consistently. Gentle, regular calf stretching before bed has reasonable support and is low risk. For me personally, regular stretching makes a noticeable difference. Hydration also matters, especially if you've been sweating and exercising or taking diuretics. Reviewing your medications with your doctor is important. Diuretics, statins, and some inhalers can contribute. And in many older adults, the true driver is nerve or spinal change. Mild lumbar spinal stenosis or peripheral neuropathy can increase night cramp frequency. In those cases, magnesium will not fix the underlying mechanism. That is why this problem is so frustrating. Night cramps are not one single disease. They are a symptom of multiple possible drivers. Some people respond to magnesium, some respond better to stretching, some need medication review, others need evaluation for nerve or spinal issues. There is no single universal answer. So let's bring this together. Most night cramps after 60 are not explained by low magnesium on standard blood tests. Magnesium glycinate is not a reliable solution for everyone, but some people do notice a clear improvement. If your kidney function is normal, it is reasonable to try this for a few weeks and see what happens. But remember, do this in consultation with your doctor. If it helps, continue. If it doesn't, stop. If it doesn't, then magnesium is probably not the treatment for it. And it's worth looking at other factors like muscle tension, sleep, hydration, medications, and nerve or spinal issues. Night cramps are common as nerves age. They are very uncomfortable, but they are rarely dangerous. And most importantly, they are manageable once you understand what is actually driving them.